In Chapter 19, we will explore blood vessels, both looking at the histology of blood vessels in this Show Me, and there will be subsequent Show Me's, which will talk about blood pressure and also the flow of all the arteries and veins around the body. The first thing we need to go over is some definitions of specific blood vessels. So a blood vessel obviously is a vessel that has a beginning and ending at the heart. It will take blood from the heart around the body and then back to the heart through a sequence of almost pipes, if you will. And remember, it works with the lymphatic system to circulate fluids. Now, the definition of an artery, as we defined before, was a vessel that carries blood away from the heart, and we know that that's mostly oxygenated, except for the pulmonary circulation, where we know that it's flip-flop there, and also the umbilical vessels are different as well. We know that veins will bring blood back to the heart, so arteries are coming down, our veins are bringing it back. This is the heart here. And they will be deoxygenated mostly, except for the pulmonary circulation and, again, umbilical vessels. And the capillary beds are what we find in between. So capillaries are in between the arteries and the veins. So what you're specifically looking at in this picture is how the arteries, which come out of the heart then, go through a series of size changes. So they get smaller and smaller as they move down towards the capillary bed. When they reach this area, they're now called arterioles, which I think we've talked about before. So these are your arteries, and there's different types. You've got your muscular arteries, and you've got your elastic arteries, so on and so forth, that are for conducting and distributing to the body. Then we have the capillary bed, which is the exchange vessel here. It's the capillary bed. Then we have the smaller veins called venules, which are there, that lead up into the veins, and then those are eventually going to dump into the IVC and SVC, which will then bring the blood back into the heart. So this is the overall flow. Also notice in the middle here we have the lymphatic system. So the lymphatic system has little pieces down here that will communicate with the capillary bed, and their job, remember, is to grab excess fluid, excess interstitial fluid, and return it back into venous circulation. When we look at blood vessel histology, the first thing to look at is the layers of the blood vessel. So these are the layers of all the vessels in the body except for capillaries. Capillaries are separate. They're down here. We'll talk about those separately in a little bit. So the three layers are the tunica. The tunics, first one's called the tunica intima. Okay, intima, which is the internal layer. Then the media, which is the middle layer, and the externa, which is the outer layer. So you see that I wrote over here, it goes from deep to superficial the way that I wrote it here. So three layers of blood vessels. So I've highlighted here the tunica intima, which is made up of mostly endothelium. So we go back and look at our types of tissue. It's a type of epithelium. It's simple squamous epithelium, and it lines all vessels. It's continuous with the endocardium of the heart, meaning the vessels that go into and out of the heart. There is no line, so you can just, the vessel just flows right in. There is no distinguishing beginning and end. It is continuous, and this is to reduce friction so that we don't have any unnecessary or undesired blood clotting. The second layer, or middle layer, is called the tunica media. And as you see here, what type of tissue are we looking at with this? Anyone remember what type of tissue that appears like? That is going to be smooth muscle tissue. So the second layer is made mostly of smooth muscle tissue. There are other pieces to the layer as well. But remember that this is going to be important for your vasospasms, so your vasoconstriction, which will be increasing. So constriction will be decreasing the diameter, and dilation would be increasing the diameter of the center of the blood vessel. It is the largest layer responsible for maintaining blood flow, and also it's responsible for blood pressure, specifically in the artery. This is the layer that makes changes for blood pressure. The outermost or superficial layer is called the tunica externa. Used to be called the tunica adventitia, which is how I learned it, but now it's changed names. It is mostly connective tissue, collagen fibers that anchor and support and reinforce the wall of the blood vessel. and it also is infiltrated, as you can see if you were to take a closer look here. It's infiltrated with little tiny nerve fibers and blood vessels. And the blood vessels specifically, this is called the vasa vasorum, which, if you know your Latin, means literally vessel, vessel. So it's the little tiny blood vessels, all spotted throughout here, and also you see it over here in the vein. Little tiny blood vessels that supply blood to the blood vessel, because remember that just like the heart, the tissue of the artery and of the vein does not use the blood traveling through its lumen. So it does not use the blood going through it. It's going to get its blood supply from the outside in. Capillaries are microscopic vessels. We can only see them using other means besides using our eyes. Their diameters are very small. So as you see here, diameter is large enough typically for just one red blood cell to pass through. And they are just made up of the tunica intima. So the intima layer that we saw in the artery and the vein is continuous with the capillary. Capillaries only have one cell thick walls, and that's important because then it will be easier for diffusion of gases and nutrients plus waste and hormones to all be able to cross those walls very easily. So when we look at actual capillary bed, we see that it's a network of capillaries between arteries and veins, specifically between arterioles and venules. And so we see we see two types of capillary beds really. One is a true capillary, and one is called a vascular shunt, which is a channel that connects the arteriole directly with the venule. So you'll see if we go back and look at the other picture, if we go back and look at this one, we saw that there was a vessel here that did not have a capillary bed, but it is still considered a capillary because it's a continuation of the arteriole into the venule. Capillaries have sphincters, so you'll notice in your text there's a picture where there's sphincters. There's these little muscular sphincters here. What did I just do? That are responsible for opening and closing. So when the sphincters are open, it allows the blood to flow through the capillary bed, which would obviously then say if this was like muscle tissue, then the muscle would be getting lots of nutrients. But say, for instance, the capillary bed was closed, so if these sphincters were all closed, then the blood would just go straight through the middle. It would not go out into the capillary bed, thus keeping blood away from whatever tissue this was. So if this was muscle tissue, say we were, in parasympathetic mode and we weren't needing to use our skeletal muscles, so the blood's still going to be passing through, okay, but it's just not going to be going out into the capillary bed. So this is kind of how sphincters are important in the body, even microscopic sphincters that will control blood flow through the capillary beds. One more word that I didn't use was lumen, so make sure you know what this word lumen means. Lumen is the actual space that the blood passes through. So what's inside of each of these vessels is the lumen, the blood carrying space. And that's not just for blood vessels. We have a lumen inside of our digestive system. So lumen really in the body is a space where something is carried through. Interestingly enough, if anybody watched the show Dexter, and you think about what his girlfriend in the last couple seasons, what her name was, her name was Lumen, which when I watched it, I was like, wow, this is brilliant. Like, they named his girlfriend after blood vessels because, as you all know, if you watch the show, he's obsessed with blood. Anyway, if you look at this slide that compares an artery to a vein, this is supposed to be a comparable, like a corresponding artery and vein. And what we see typically is that the walls of the arteries are typically thicker than the walls of the veins. And so if you look specifically at the layer that's thicker here, which layer can you see? It's this blue layer, and that is actually going to be the media layer. And which tissue did we say makes up the media layer? Hopefully you're thinking smooth muscle. Okay, smooth muscle tissue. So what we're seeing is that we compare an artery and a vein of similar size. The muscle layer in the artery is going to be thicker than in the vein. Now maybe you also notice that the shape is different. Arteries typically have a rounder shape, whereas veins are more flattened. Also note that typically the lumen of an artery is going to be a little bit smaller than the lumen of the vein. Now in this picture it doesn't really look like it's that different, but typically the lumen is going to have a larger volume here and a smaller volume here, which means that if we look at the overall percentages of where blood resides in our body at one given time, so at this moment in time, most of the blood in your body falls into the veins and venules, whereas arteries and arterioles only hold 15%. Pulmonary vessels 12%, heart, and just a little tiny 5% for the capillaries. So we see most of the blood is residing here, which is why the veins are often called capacitance. Okay, capacitance vessels, and really they serve as a reservoir for blood. Veins also have some modifications that I failed to mention, so valves, and just like valves in the heart, valves in the veins are to permit backflow, and veins also have what are called sinuses, which are flattened veins with really thin walls. We see some of these in the heart, so you might have learned the coronary sinus already, I hope you have. And also there are sinuses in the brain, so we'll see the transverse sinus and the sigmoid sinus, and so on and so forth.